A new public health awareness campaign was recently started in Massachusetts around sepsis. It's the body's life-threatening immune response to infection. To tell us about the campaign are a nurse and sepsis survivor with the Sepsis Alliance, Doreen Bettencourt, and the Director of Policy for the Betsy Lehman Center for Patient Safety, Lisa Conley. Thank you both for being with us.
Thanks for having us.
I'll start with a general picture from Lisa. I usually heard about sepsis as something that happened to somebody when they were in the hospital, but what's the rest of the story here?
Yeah, that's a great question, Chris. So that's one of the misconceptions of sepsis, is that you get it in the hospital, but actually most people get it out in the home or a community setting. So about 80% of people will get sepsis after having an infection at home. And the important thing is to really recognize the signs and symptoms of sepsis early on so that you can get treatment quickly.
Right. Doreen, you got sepsis. How did that happen, and how did you realize this is what you had?
I went in for a surgery that was pretty common, and at the end of the day, I wasn't feeling well. The doctor was ready to release me. I wasn't feeling well, asked if I could stay. And not knowing what sepsis was at that point, or my family didn't know, they started realizing I had subtle signs that they were reporting to the nurse. My sister said that I was warm. My son said I was getting confused. I was having a lot of pain. And we reported it to the nurse that, things weren't going very well.
And what happened next after you told the nurse all these things?
It wasn't recognized for 2 days. And on the second day it was recognized. I was in severe septic shock at that point. So I had a heart rate that was up near 200 beats a minute. My respirations were very fast. My blood pressure was very low, which are your classic symptoms for septic shock.
Lisa, what about that? Because you said this could happen at home. What kind of things could trigger this?
Yeah, so that's a great question. The most common causes of sepsis are either like a lung infection, so maybe you get the flu and it stays on too long and you get pneumonia from that. You can also get it from urinary tract infections, but you can also get it from an unclean wound. So if you don't clean a wound properly and it gets infected, that too can turn into sepsis.
Now, this also sounds like something that doesn't, slam down on you suddenly. It builds and it builds and it builds. So
Yeah.
What should people be on the lookout for?
That's exactly right. So what people really should be looking out for are, 6 symptoms. So one is confusion, a very high fever or a very low temperature. So if you have fever and chills, extreme pain. A lot of people who've experienced sepsis note that they feel the worst they've ever felt in their lives. So the sense that you feel like more terrible than you've ever felt. So it's more than your average flu or cold symptoms.
Explain the reason for that. I imagine this is the immune system attacking organs in the body, maybe? Or?
Yeah, it sort of gets overwhelmed, and Doreen might be better able to answer this being a nurse, because I'm just a lay person. But yes, it's sort of like your whole immune response sort of overwhelms your system, and it starts going after your organ.
Explain, because I'm sure you've seen this when you work later as a nurse, right?
Yeah, that's exactly what it is. So you start with an infection, and it's your body's reaction to that infection, which will start. You'll end up with a lot of inflammation. You can end up with organs being attacked by your own body.
I'm curious
from
about
the sepsis response.
One other level of reaction is that you didn't become a nurse until after you had sepsis. Explain that sequence.
I was working at Coca-Cola, actually, and when I went into the hospital, I ended up spending a total of almost 2 months in the hospital. And it really affected me to want to make a difference in the healthcare field. So I spent 2 months in the hospital, and then 4 or 5 months at my mother's house afterwards. It took a toll. And then I went to school and became a nurse.
When you say about making a difference, I mean, does this also maybe have something to do with the way people communicate? Because it seems you had a problem with communication at the beginning of this, didn't you?
I didn't. I was septic in 2004, and it wasn't as prevalent as it is today. So I don't think it was a lack of people not caring. I think it was a lack of, even in the medical field, nurses not really knowing, and as years go by, sepsis is so much more prevalent in the hospitals, and we've come so much further with it that we're able to recognize it.
What about that, Lisa? It seems there's more than just science here. I mean, it's almost like patients have to know how to advocate for themselves too, isn't it?
Yes, absolutely. And we encourage people to know the signs and ask their doctor if this could be sepsis, because sometimes, maybe you have a number of different issues going on with your health, and it can sometimes just help the healthcare provider sort of figure out what's going on with you, that this is an unusual occurrence in your life.
Well, one of the things you have are some props here to draw our attention, and you have a little orange thing. Could you maybe explain
Yeah,
what that's supposed to mean?
Yep, we have a Sepsis Smart. It's antiseptic alcohol. So basically, you can just squeeze it into your hand and rub your hands together, and that helps to sort of destroy the germs on your hands and potentially prevent infection later. And so we're just using this as a sort of a reminder to everyone to practice good hand hygiene, because preventing sepsis is actually the ideal thing to do. And you can do that by getting vaccinations and also practicing good hand hygiene.
This has been the news. We're talking with Doreen Bettencourt from the Sepsis Alliance and Lisa Conley from the Betsy Lehman Center for Patient Safety. Doreen, I can imagine you rubbing your hands like that when you're working in the hospital. Do you do this at home too?
Yes, we do.
Why do you do this at home?
Because I know if I don't have proper hand hygiene, what it can lead to.
Right. Finally, Lisa, if people want some more information about what to look for and what to do about it, you have something that they can check out online, maybe?
We do. We have a state website. It's mass.gov/sepsis. So it should be pretty easy to remember, and people can navigate to that and get all the information they need about sepsis.
Thank you both very much, Lisa Conley and Doreen Bettencourt.
Thank you,
Thank
Chris.
you.